Up to 70% of Shanghai's 25 million people may have been infected with COVID-19 in the recent outbreak. That's according to officials in the city's top hospital. China is seeing a rising number of cases and deaths since it rolled back strict pandemic curbs. Scientists are expected to brief the World Health Organization on Wednesday as concerns mount over the country's reporting of pandemic figures. Around a dozen countries have announced testing requirements for travelers arriving from China as the country gears up for its holiday season starting on Sunday.
We are willing to strengthen communications with the international community and work hard together to overcome the pandemic. At the same time, we also believe that some countries have imposed entry restrictions targeting only Chinese travelers. This decision lacks scientific basis and some practices are unacceptable. We firmly oppose any attempts to manipulate epidemic prevention measures in order to achieve political goals. We will take countermeasures based on the principle of reciprocity.
Let's bring in Dr. Bharat Pankani, who is a senior clinical lecturer over at the University of Exeter's Medical School. He has over 20 years of experience in communicable disease control and infectious disease management. He joins us now from Bath in the UK. Dr. Bharat, always a pleasure to have you on the show. First off, I want to ask you from a public health perspective, why you think China almost overnight went from sort of recent, very strict lockdowns to very quickly abandoning its zero COVID policy and rapidly opening up. What's the explanation here?
There is no explanation. All I can think is that the Chinese government has its own political cycles and conferences and re-electing its premier for the third time, and all that out of the way, it could now suddenly do a U-turn and open it. There is no scientific basis for suddenly doing that U-turn.
Okay. I don't know, maybe you want to call it, stabbing the hand that feeds you. I mean, maybe it's a poor analogy, but I mean, when China, at the beginning of this pandemic, was crying out to the world that it didn't want to be associated with this virus, didn't want the virus to be called the China virus, that it was working closely with the WHO. I mean, doesn't it sort of give a bad impression when all of a sudden you stop providing data to this organization, data that could be so important in terms of understanding new variations, new mutations?
Indeed. So it's a story of multiple divisions. Number one, China is going to have a huge rise in number of cases, and that will be followed by number of deaths. And of course, China doesn't want the rest of the world to see its large death rate and large number of people infected. What China can do and should do really is at pace. And China can do a lot of things in its manner, in the way it operates, is immunize its people. So if it really wanted to reduce fatalities and infections, immunize, but immunize with better quality vaccines. The fact that we don't know the case numbers is one thing, but what we really want to know from China is, in case there is a variant that has started to circulate, which could cause harm, like bypass the vaccines that we have used in Europe and Northern America. That is the bit that we really want to know from China.
Okay. I mean, when you look at the numbers, they are truly staggering in terms of the number of infections and the number of deaths, even though it's not being reported. And you said that China is going to see a huge rise in this. I'm wondering, as a medical professional, how much of a risk you think this is for the rest of the world.
I am reasonably comfortable, especially for countries like Europe and Northern America, where they have used the mRNA vaccines. So at this point in time, we know what we know, and we know that what is circulating in China is also circulating in other countries. So far, so good. We also know that our mRNA vaccines are much better, much better than the ones that the Chinese are using. So I think this becomes now a story of two parts, which is, in countries where we've used the mRNA vaccines, people are by and large in a safer position. Whereas in China, where they have not used the better performing vaccines, their population remains vulnerable, and were they to get infected, some of those vulnerable people will become seriously ill and some of them will die.
Okay. Dr. Bharat Pankhania, we're going to leave it there. Thank you very much for joining us here on the NewsHour. Appreciate it.
Thank you.